The biggest thing is living my life and getting along and doing the things that I'm used to doing.
That's all Dave Brandt wants to do, return his life back to normal. He thought after receiving both doses of the COVID-19 vaccine that would happen. But as 10 News reporter Malik Jackson explains, an antibody test pushed him back to square one. Malik?
Yes, Sean, a test that sent him back to square one, but a test he's glad he took. After 17 months of seclusion, Dave Brandt hopes a third dose is the first step back into what life was like before.
We've been secluded from our friends. We've been secluded more or less from our church. And we're just waiting to get back into normal life.
Dave Brandt has been shut out from the world for 17 months because a battle with COVID could be deadly.
It started out, I had a melanoma on my chest, and that was back in the late 80s.
6 bouts with cancer later, victorious in all of them. A natural-born fighter with more than 27 years as a firefighter. Brandt got vaccinated early on, hoping to open the doors to the world again. But a suggestion would change everything.
That it would be a good idea with the blood tests that they do to check my immune system and my antibodies.
The test sent him back to the drawing board.
That means that I have to be extra careful and be sure to wear my mask anytime I'm around other people.
Now getting a third dose isn't an option. It's required for a sense of peace, but more it means life or death.
I'm lucky that nothing's happened to me with the false feeling that I had all these extra antibodies.
Brandt, who still receives maintenance infusions, is sending a message to those who, like himself, are immunocompromised.
They should maybe get their antibodies checked and see if it did work.
Good news for Brandt this morning. UT called him and informed him that he qualified for the third dose shortly after our interview. This morning, he was headed to UT to indeed receive that third shot. I also spoke with Dr. Bill Smith, the CEO of the Alliance for Multi-Specialty Research. He stresses the need for immunocompromised people to get that third dose. He says 40% of those that are hospitalized with COVID-19 who are vaccinated are people that fall into that category.
It's extremely important for people that are immunocompromised to get the third dose. And a third dose of the same vaccine that you received previously gives a significant boost to your antibody levels.
Now, for the general population, a booster shot is recommended 8 full months after the first two take effect, according to the CDC. John, Beth.
Malik, we appreciate it. Thanks for the update. Tomorrow, the University of Tennessee will host a public COVID-19 clinic at Neyland Stadium. It will offer the Moderna vaccine to anyone 18 and older. Anyone receiving their first dose will have an opportunity to sign up for their second dose at the Student Health Center. You can make an appointment for the clinic online, and we do have a link in the As Seen on TV section of the WBIR app. And if you or someone you know is looking for a vaccine, we have a list of resources to help you find one. Just text the word vaccine to that number on your screen, 865-637-1010, and we will send you a link.
Well, active COVID-19 cases